Great. So the title of my talk is The Role of Exercise in Supporting Kidney Health. Next slide. So what I'd like to talk about this evening is I'd like to talk about the role of exercise and physical activity in promoting and supporting health in people with kidney disease. I'd like to talk a little bit about the research behind that, scientific research, and also the patient experience. And I also want to talk a little bit about how we can make moving more easier and part of our kidney care culture. Next slide. So I'm a nephrologist, so I get to make fun of nephrologists. So this is my impression sometimes of how nephrologists see the world. So if you could just advance there for the image. So it's a nephrocentric universe. It's a kidney-centric universe. And oftentimes, I think in nephrology, certainly as doctors, we focus on the kidney and the biochemical effect of the kidney and the numbers and so on. And we often forget that when your kidneys get sick, your whole body gets sick. And so I think that that's really important when you are trying to care for somebody holistically. But is often, not highlighted to patients when they are seeing their physician, and really their primary concern is how they feel and why they don't feel better, for example. So next slide. So I think it's really important just to always acknowledge that the effects of kidney disease can affect your physical functioning. And this isn't always clearly explained, that there actually is a pathophysiological reason why you don't function physically as well. So if you could just click next. So I'm going to highlight this with a common example. So when the kidneys stop working very well, you might know that they stop clearing acid from the blood. And sometimes your doctor will put you on sodium bicarbonate, and that's why we put sodium bicarbonate in the dialysate if you're on dialysis. So this is what happens when the kidneys start to fail. Acids start building up in the blood. Next slide. And we know that that can actually lead to fatigue. So the effects of the acid on the muscle can actually cause it to not grow as strong or reform muscle as strong. So one of the effects of that is people feeling tired. And we happen to know that fatigue is a very common complaint among people with kidney disease. Next step. So what happens if you feel tired is naturally you're not going to want to engage in physical activity. Next step. And then when you don't do physical activity, the body does miss out on that opportunity to grow back stronger. So you may have heard, if you don't use it, you lose it. And this is sort of a fancy way of explaining this. So if you don't break your muscle down and let it build back up stronger, then it won't get stronger. And if you don't let your heart pump and your body work and your blood pressure lower when you exercise, you don't get that benefit. And what happens next, if you just do the next slide there, is we see this as a decrease in endurance and muscle mass and strength, and also in balance and coordination. Next click. And so what does that lead to? Well, you see that in your everyday life. It gets harder to get upstairs. It gets harder to play with the grandkids for longer, and people tend to feel more played out. Next step. And then overlaid on top of that are the effects of kidney disease. So when I say uremia, I mean the kidney toxins. Inflammation is higher with kidney problems, and then nutrition's harder. And nutrition's harder for a lot of reasons. It's a lot of reasons to do with the things that we say that you can't eat, and also just having a loss of appetite and food enjoyment. Next slide. And so then you can see with physical functioning, if doing everyday things becomes more of a struggle, you're going to become more sedentary and less active because it doesn't feel good. It's not as enjoyable. And you can see from that cycle that it just sort of propagates. And I show this slide for two reasons. Number one, I think it's really important to know that there's a physiological reason why exercise is harder for people with kidney disease. And I think the people who I've talked to do try to beat themselves up and say, I know I should be. But listen, give yourself a break. There is an actual physiologic reason. And this is just one why it can be more difficult. But I also think that this slide is nice in the fact that it shows you that we can break the cycle by working on that middle rectangle, the physical activity. that if we start promoting that we can interrupt this vicious cycle of deconditioning and having less life participation. Next slide. So how can exercise help? These pictures to me, they're taken from our exercise program in Alberta Kidney Care North, with the exception of Buzz there, who's from Lethbridge. He's one of our patient partners on Kidney Walk Day. And what these pictures sort of highlight to me is, well, I'm going to tell you about all the scientific things that exercise can do, but ultimately these people were doing exercise for their own reasons. The lady on the bottom wanted to get stronger for transplant, as did the gentleman on the left of the screen. The fellows on the top, one of them had restless legs and the other one was just bored during dialysis. So people find their own reasons to get more active, and that's ultimately what makes it enjoyable. Next slide. So does it actually help? What do the studies tell us? So we do know, and we can tell you, that no matter what your stage of kidney disease, that regular exercise, something like 3 times a week, and how long depends on, where you are starting. But we do know there's benefit from even just doing 10 minutes at one time to start with, that if you do that, you can improve quality of life for the physical aspects. So how you feel, functioning in your everyday life. We know that we can actually improve objectively measured things like fitness. So it is easier to walk upstairs and get around the grocery store. And we do know that we can increase your strength, your ability to get in and out of a chair and get in and out of the car and around easily. We know that we can make people walk further than they did before they started exercising. Next slide. There's been probably the most research on the benefits of exercise in people with kidney disease on those people who are on hemodialysis, in-center hemodialysis. And I think that's for lots of reasons. It's a good place to test things because people are there already and they'll tend to do it regularly. So what they've shown is that it is a fairly effective therapy for decreasing restless legs, those symptoms, if you exercise during your treatment and that's when you experience that symptom. And so people will often ask for the bike when they're on their dialysis machine when they start feeling their restless legs coming on. There's been several studies to show that it improves depression scores, and that's just from doing cycling during dialysis. And there's some evidence to also show that you can enhance phosphate removal by cycling on dialysis. Just by letting the circulation and the blood flow to the muscles increase, you access those extra compartments and can help clear phosphate. We don't know as much about other symptoms. Certainly people anecdotally in our program have found cycling during dialysis very effective for decreasing the severity and the frequency of cramps that they get when they run. We don't know the effects on activities of daily living as well, and that's what I find really interesting is, can we help people be more independent in their homes for longer, particularly for people doing their own dialysis at home. Could a regular exercise routine keep them independent doing their own dialysis at home for longer? And then sleep. Sleep is a big problem, and so that's somewhere else where we need a little bit more research. There's been some evidence to show that we can improve the quality of sleep, but still there haven't been that many studies. Next slide. And so that's what the research says, but what do our patients say? And these are selected quotes from people in our program over the years, and I picked them because they're the ones that we tend to hear the most often. So I'm more steady on my feet. My legs were pretty shaky before and now they're not. I had restless legs and I still have it, but surprisingly not as drastic. Like I do a fair amount of walking myself, probably 12 blocks a day, and so my legs are fairly good, but I cannot keep up to my wife if we went shopping. Now I can. Oh, I get cramps. Every dialysis run I had cramps, but after doing exercise, I have no more cramps now. So that's a common one. Next slide. And so in terms of research, people I find are often curious about what benefits they could accrue from doing exercise. And there's still big ones that we don't know about. So we did do a survey to ask patients, caregivers, decision makers, researchers, clinicians, what they thought were some of the most important questions to be answered in exercise. And these are 3 of them. And several of them pertain to transplant. So one is, what's the effect of an intensive post-kidney transplant rehabilitation program for patients who have been on dialysis for many years? And can exercise interventions before kidney transplant improve surgical outcomes, sort of like a prehabilitation before getting transplanted? So things they're worried about, want to know if exercise could improve would be, could it improve their graft function? Could it make them recover from injuries earlier, and the recovery post-op? And then finally, from some other work, a commonly asked question was, can exercise delay the progression of kidney disease? So we don't know the answers to any of these yet. Certainly there's some very promising studies that show prehabilitation before kidney transplant does make post-op rehabilitation easier and may even decrease your hospitalization time. But these are just some examples of some questions, and it's a very exciting area of research. Lots of questions left to answer, but it also highlights that there's a bit of a gap in that transplant patients, the benefits of exercise in that group hasn't been as well studied as, say, hemodialysis. Next slide. So I've told you all about the benefits, and I've talked about it like there. All you have to do is do it and you'll get the benefits. But I think we all know, and we can all acknowledge, that actually starting an exercise program and sticking with an exercise program is very difficult. So we cannot pretend that it is you just give somebody some equipment and they'll get the benefits. It's a complex behavior. Next slide. So why is it so hard? And this has been actually pretty well researched in people with kidney disease, particularly people on dialysis. So what is the particular barriers for that group? And so what patients have said throughout the literature is that really there's this fear of injury, not knowing what to do or how to do it, the need for an exercise companion. And then of course there's the feelings, these sensations of symptoms that you experience when you exercise that you may have already, like weakness and shortness of breath. That is a little unnerving if you don't have body confidence that this is safe. So those are some of the barriers. And, you know, the barriers for nephrologists and unit staff are also very interesting. And the common one that comes up is no time. So no time to ask about it, no time to counsel about it. I think that we don't have a great knowledge of exercise unless it's your personal interest. And we also make an assumption that patients aren't interested, which actually is not true. When we've done a number of surveys, and not just myself, but across countries, what always comes across is that patients are actually pretty interested in exercise. They just don't really know how to start, or if it will benefit them. And they actually, 25% of patients in one survey of about 400 people in Canada, they thought that they actually couldn't safely exercise. So 25% thought that, which is a good deal higher of what we would really expect. There actually are very few contraindications to starting an exercise program. Next slide. So let's talk a bit about exercise programs as part of kidney care. So Alberta Kidney Care North and Alberta Kidney Care South both have kinesiologists, so exercise specialists and exercise programs. And they're very helpful, and they're very helpful too if they can get you started, which is often the leap that needs to be made. And I think a lot of the time our approach to starting a new behavior is, got to get motivated. I got to get motivated to do X. I got to get motivated to change my diet. I got to get motivated to exercise. But another way of thinking about it is actually motivation comes from doing. So once you start, once you have the action, that actually gives you a little bit of motivation, sort of like a self-efficacy that you can do it, and that leads to more motivation. And the kinesiologist can sometimes give people that bit of support to trust their bodies, to just get into it and just give it a try, which really can get people feeling more motivated. So how these programs work in both kidney programs is they are led by kinesiologists who have experience working with people with chronic conditions on dialysis or kidney disease or transplants. And that unit staff, if it's in the dialysis unit, will help deliver the equipment and so on. But it is run by people with that expertise. In terms of participation, it really depends on the unit. We've had 70% of the unit on cycling during dialysis and doing home programs, and we've had 30%. So it really does depend too on the culture of the unit. too. But really, that really important piece, I think, is having an exercise specialist. So if you are part of those programs, I would ask after them. If you are part of a program that doesn't have that, if you're from out of province, it's really important to start asking, because I think the assumption is that patients aren't interested. Next slide. So what do we do in the program? I'll just give you a sample of something we would commonly do. One of our kinesiologists will be asked to see somebody. This lady was asked just to be seen because she complained of feeling weak. She was 77, she had high blood pressure, she was on hemodialysis. And all they started this lady with, because it was right for her level of conditioning, was 10 minutes of cycling 3 times a week during her hemodialysis. And that is just a perceived exertion. So really moderate, nothing too heavy, or we didn't want people working too hard. It's not necessary to do that to get benefits. And then we gave her some TheraBands just to work on her lower body, but it was primarily cycling. And so can you press that next slide? So we do measure how people are before they start the exercise and how they are after they've done our exercises for 6 months. And at baseline, before she started the program, she could walk baseline, you can see 100 meters. And for a normal person in slightly younger than her, the normal is about 550. So it just shows that she was deconditioned. And then after 6 months, she more than doubled that just from doing that amount of consistent activity during dialysis. We also measured her strength by her ability to get in and out of a chair, how many times in 30 seconds, and that did improve modestly as well. But it was very impressive that she improved her walking time that much, because it really translates to being able to function a little bit better in your everyday life. Fewer breaks at the grocery store, a little bit more confidence, making it across the street to make that light. So it makes these small differences in your everyday life too. Next slide. I've focused a lot on exercise. And so when we hear the word exercise, we all have notions about what that means. It is a planned, structured activity. But I really want you to come away from this talk appreciating that all movement counts. And I see Nancy Verdon is here, and she can speak to that as well. She's a huge proponent of that. And it's so true. All movement counts. So we're talking about, it could just be getting dressed. It can just be walking out to get your mail. Movement counts. And I think that was really summarized by this patient in this editorial in a very popular nephrology journal. What her comments were about this issue of how we talk to people about exercise really resonated with me. And if you could just press the next key, I'll read it. So this lady who's lived with ESKD herself for many years, she's been on dialysis and she just recently was transplanted, offered the following. As a patient with kidney disease, most of my days, I'm in a constant fatigued state. How can I exercise when I'm already tired and short of breath? During those times, my body will not allow me to exercise when simply walking from one room to the next has already elevated my heart rate. Maybe we need to redefine exercise. Although there are standards that have been set forth, we also have to consider that some activity is better than none. And I just wholeheartedly agree with that. I found that very poignant. Next slide. So let's talk about putting it to practice. So I've talked a lot about the individual level. What can we be doing as providers? Can you press next? So in the clinic, when you're waiting for your clinic appointment, when you're waiting in dialysis, is there more we could be doing in terms of education, in terms of programs? I know Nancy and her PACER group had come up with a waiting room fatigue, or were involved in that in terms of how to manage fatigue. And that's an important part of managing energy and trying to be more active. Next piece, the home. So we focused a lot on delivering exercise in the hemodialysis center. But that survey I referred to of several hundred dialysis patients that was done just a few years ago, actually 73% of people want to exercise at home. So what more can we do, especially with the pandemic? We've all become very aware of the fact that we need ways to keep active and engaged at home. So is there a way we can work with community providers, adopt more virtual means of delivering our programs to make that happen for people, to offer more flexibility? And next one. and connectivity. So even if you hate exercise, I think the carrot is social interaction, because exercise can be a great excuse to get together with friends and go for a walk outside. And you know, just thinking about these elderly men who I'd always see walking in the mall together religiously when I cut through to get the LRT a few years ago. And, you know, I came aware of the fact that probably it was the coffee after that really brought them there every morning. So I think we need to really acknowledge that and just try to find ways to integrate it into a way of being and not another task. Next slide. So my final points, I think, you know, as patients, we hear your voice. I urge you to move to close the gap and try to push us to become more active. And you can just hit those last few points. So just think about being more active and how that can actually make you feel better rather than what you should be doing. How can it be more enjoyable? Social connection is one very, very obvious one. Ask your care team about getting individual advice. Can I talk to the kinesiologist? Do you have a kinesiologist? Why not? Next one. And exactly, you need to ask for it and about it. Next slide. So really, in summary, we acknowledge that kidney disease can affect your physical function. Action can lead to motivation. So it's not always sitting waiting for motivation to strike us. All movement counts. We really want to be delivering exercise programs that includes the home and fosters connection, because I think that's what keeps people engaged. And then we also need a culture change, and we need to do our end and meet the needs of the patient and talk to patients about it. So that's my final slide. My next slide is just a thanks to thank you for inviting me to talk, and my team of kinesiologists, and as well as Julie Nahn, who's our manager. If you want more resources, this is a great website, this Global Renal Exercise, and they have good patient information. And there's also research opportunities. So we're conducting focus groups on promoting wellness and developing wellness programs. So email us if you're interested in just hearing more about that. Thank you.
Thank you, Dr. Thompson, for sharing the role of exercise and how important it is for kidney health patients. So I'm now going to open it up.
Stephanie, appreciate it very much. Again, the good discussions on the positive impact that exercise has for kidney health, and we're proud to support your program. So, and I think exercise all around. So our next presenter is Tracy Harris. She will be presenting